right. Hello, everyone, and welcome to another edition of Clock Talk with Dr. Greg Brannon. Greg, how are you?
Kicking it.
Fired up, huh?
Fired up.
T levels up around 1,000 right now.
I got placed last week, so that's pretty good.
I think I'm in my third month, and it's usually when I feel the best.
Okay.
You know,
I tilted a little bit because I got placed. I'm a little tender right there, but yeah, ready to rock and roll.
sounds good. So I want to obviously talk about the world-class BHRT pellet that we treat patients with exclusively, and compare that obviously to other options, but talk about some symptoms today.
Good.
So it seems like a lot of our people, patients that come in, are experiencing fatigue and brain fog.
All day.
What happens? How does that happen?
It's very interesting, Jim. I don't care if it's a 20-year-old boy, a 45-year-old mom with 7 kids, a 60-year-old guy, 80-year-old guy, it doesn't matter. Number one reason people say, I'm tired of being tired. Everybody's tired of being tired. Number 2 is brain fog, losing words, memory. Next is like mood, anxiety, depression. And then I'll say 4 or 5 is, I'll say 4 is like body shape, size, getting weaker in the gym, or have no motivation to go to the gym. Motivation is a big one. 5th's libido. The libido is like ice in the cake. It's not the top of it. But it's very important, Jim, is we're never anybody's first doctor, ever. They go to the doctor. Here's the thing. This is what I'm going to beat in my head. I think when you look at all our patients, we've probably placed, I don't know, 850, 180,000 people, placements. Every initial patient, every single one has come to us with the same complaints, and they're all within normal range. I went to my doctor, they checked my thyroid, I'm normal. I went to my doctor, they checked my hormone level. The women didn't check the testosterone, they didn't check it. Now we put them in abnormal ranges. But it's interesting, people don't realize this. These were physiological normal levels 6 years ago. That's what's important. These are not giving a woman man's levels. It's not giving a man, Superman's levels. These are physiological normal levels in the 1940s. That's what's so good about having this data. Nobody ever answers, why are we lower? Right. Did we evolve in the last 50 years that we evolved so well we don't need hormones? That's garbage. So something out there is causing our inside to go down. That's where these symptoms come from. So when we talk about all this kind of stuff, all I want to do is get people into, and we have a 98% retention rate by you getting these levels. So what I'm trying to do, Jim, is to get people to understand what we're chasing. It's like, let's get everybody's a fasting blood sugar under 90 would be healthier. Same thing here. We get everybody have this testosterone level in the top percentile, be great. Mm-hmm. We know there's a great paper. They really pushed me over the edge in the when I started doing this about 15 years ago. Looked at 70,000 men over the age of 50. Men over 540 versus men under 350. The 350 group had an 88% chance of a heart attack in 4.5 years and 41% chance of death. Now, my family history is heart attacks bad. I'm going to have one any day, but I've pushed it out 30 years. So we have to understand what this thing does in inflammation, all these kind of benefits. But these symptoms and signs we have are not just nuisance. Here's a Zoloft to stop, and not saying not knocking, you don't need it, but not 90% of us need this stuff. Mm-hmm. It's like, what's going on? Let's find what's going on before we mask it. That's my passion right now.
So from a physiology standpoint, what's causing the brain fog?
Well, the brain not shooting properly. Think about the brain. This is important. The brain is 100% fat. Okay? You get neurons, and you have this thing called glial cells. The glial cells are actually the structure that supports the brain fat. So you have the white matter and gray matter, right? All the matter is made up is cholesterol. 80% of the brain is cholesterol. So a low-fat diet destroys the brain. Number one. Number two, when you have less cholesterol in the brain, less cholesterol in your body, you make less parts that need it. So what's causing it, I believe, is a lot of things. We could go over, EMFs, we go over neuroendocrine disruptors, but all these are bombarding this system. Mm-hmm. So let's give what the brain needs: omega-3s, omega-9s, more fat, more protein. Brain needs sugar, so give it the proper amount of sugar. So these are things you do for it, right? We do that, but the thing that's so simple, the testosterone is what incorporates all of this stuff. It makes more brain, called neuroplasticity. So the tiredness is the brain functioning, not talking. That's called the synapse, where they actually merge together, is actually enhanced by testosterone. So let's make the brain think it's 18 years old instead of 60 years old.
With that said, the benefit of the pellet compared to the other applications as it relates to making the brain healthier again.
I'll go big one here. 2013, the NIH did a study on anxiety and depression, which are the two most common, I'll say, neurological complaints. They found testosterone is the superior treatment. So why are we using these neurotransmitters? See, again, when you start giving these SSRIs or these dopamine medications, the neurotransmitters, they're put it to make, so how SSRI works, this neuron releases serotonin to go here, and when you block the uptake, it sits there longer in the cleft so that this has more chance to grab it. Great, okay, that's the hypothesis. But the neurotransmitters, the serotonin, is actually made in the gut by bacteria. So therefore, what's important is get the proper bacteria in there. You have bad bacteria, you're not going to make enough neurotransmitter. So you want to get the right bacteria. What does bacteria need? It needs the right type of prebiotic. You need inulin. You need short-chain fatty acids. The gut-brain axis is real. And what we do here is to enhance that. Again, I believe brain fog, anxiety, depression, mood swings, these are symptoms of having low balance between your neurotransmitters and your fats and your again, but what ties this, the weaver that ties it all together is the testosterone.
Right. So then with that said, optimal bio patient compared to a shot patient, compared to a patch patient.
Okay. That's very, very important, that, Jim, because it goes back to release of the hormone. If the release of the hormone is stable, there's more benefit. And then what we have is more release, more steadiness. When you have peaks and valleys, like the shot has a 3.5 day half-life, you're not going to have that constant release of the hormones properly. So you want things that are steady, homeostasis, just like the way your glands would do that. There are papers, there are real papers. The best one I got was out of Germany that showed men on shots felt better, 22%. Men on pellets, 100% felt better. The only thing to say, so the molecule is different. I can't stress it.
It's interesting because obviously we live and breathe the pellet. But I think out of 340 million people in this country, there's probably about 339 million that have no idea what the pellet is.
100%.
Why?
I think because me personally, would I rather make a 2 millimeter incision in my skin and put something underneath there, or rub a cream on or a shot on, right? That seems easier.
Okay, that's fair.
Okay, now in the shots, very interesting, Jim. We've been talking about seed oils. Well, the two most, I'll say, toxic seed oils there are cottonseed and grapeseed. That, by the way, they're both in the shots. Those are the oils inside the shots. So these things have to be asked, man.
Right.
But I don't want to badmouth the shot in the sense that there's some good science that it works. It just doesn't work as well. That's the bottom line. It just does not work as well. And we've done hundreds, if not thousands of men who've been on, thousands of men who've been on shots who came to pellets. And they never went back. So you think about a shot. The doctors that give a shot once every 2 weeks is not doing a good service because, again, it peaks 3.5 days. You're up, you're down, you're up and down. So you do more frequent shots, fine. But the shot is intramuscular. So you're sitting there, so you're sticking this needle. If you're seeing a needle that goes there, it's a pretty good sign. Mm-hmm. You get placed twice a year, maybe 3 times a year, and you're steady the whole time. Mm-hmm. To me, it's not even a comparison. Yeah. So what I was looking for, what's the best route that mimics the body, and what's the best route that releases the chemicals at the best stage, and less pain for me. And the pellet, again, the thing about the pellet's been used for 90 years, Jim. It's not new. I think a lot of, I'll say, functional doctors will spat mouth. You can't control the pellet. You can't control it. Once it's in, it's in. You can always control a cream. But first off is, we have an algorithm. Of course you can control it. Because when you give a whole pellet, the whole pellet's not released. It's just the top surface. When you give a whole shot, the whole shot's released. What's holding the muscle is the ester. So no, it's not even close to being the same, Jim. It's like saying your ovaries don't know what they're doing. This is exactly what your ovaries are doing. Your testicles know exactly what's going on because it mimics that exactly. And again, what I have, we've had hundreds of thousands of placements who will not ever go back to anything other than pellet because it mimics it the best, how they feel.
How about bone health?
Oh, bone health. Oh my goodness. Again, the bone is so important because it's not a hard surface. It's an active system in your body. The marrow makes blood, makes platelets, makes all the clotting factor, all white blood cells, red blood cells. It's living. You have the bone itself. A good bone is strong but pliable. When it's hard and brittle, it breaks or gets hollowed out. So again, the bone is actually made by testosterone and progesterone, and estrogen controls its reabsorption. So it actually protects you from osteoporosis. Actually eliminates osteoporosis.
And then the applications, again, the shots, the creams, how does that help with the bone?
Again, they work, but not as well. Again, if there's not a magic number, but I'll just say you get 100% benefit in the pellets. You have a less than 100% with the other ways. And again, other carrier molecules are not bioidentical. I can't stress that enough. There's other things in it. There's adhesives, there's gels. There's one called polyvinyl propionate. These things are petroleum-based products. They're not bioidentical hormones.
Yeah, you're
your
drinking
body.
oil.
Your body does not make that structure. And again, the guys who sell the shots, I don't be hypocritical. I'd be in a shot tomorrow if there wasn't another route. But it's not bioidentical. Yes, it is. Once it's cleaved, it's bioidentical. Yes. The active ingredient in a shot is bioidentical once the ester is cleaved, but the ester is still in your body. And there's a great book called Neurodegenerative Disease and Sex Hormones out of Belgium that has a whole chapter 10 is all based upon the 3 synthetic categories, how they increase problems. The most dangerous one is increased Alzheimer's disease because it causes brain cells to die off sooner. So the answer is there are side effects to that. When the one your body makes doesn't have side effects, to me, it's a clear decision.
Describe the importance of building muscle around the bone.
Okay. I'll go back to the other thing too. But Jim, I think a lot of providers are scared to make a 2-millimeter incision. They're scared of the anatomy. I was a surgeon, so I was trained in that. So I understand and respect to that, but I think they don't understand the technique. And we have a different technique too than most people have. So I think fine-tuning our technique, making a procedure that's a couple seconds long to a couple minutes long, really takes away the scariness of it. There's actually another type of trocar that it's going to be dummy-proof. Well, it's nowhere close to a trained hands. Mm-hmm. So I think what scares people is the provider themselves, they don't feel comfortable with tissue. Mm-hmm. I think that's part of it. Mm-hmm. And it's easy to give a cream. And then with having lack experience on it, they don't know how to actually control the algorithm. We do, right? We've read 2 books on this, so right. we know that. Back to what we talk about the bone. The bone and the muscle system, the skeletal system work together. So when you put stress on the muscle, but stress on the bone, it makes the hormones work to make the bone proper and the tendons and the muscle stronger. It's just this is your structure, foundation of your building.
Yeah, what's the number 4 cause of death, I think?
Number 4 cause of death over 60 is falling down. Getting the bad way, get off the toilet. That's the big one. So you want to build, you're not going to be here at 80 years of age and go, gosh, I have too much muscle. Let's do that now.
Right.
And that's why it's important we do that. We do give the body the fuel it needs, the hormones it needs, the rest it needs. Because I think the game of life is a marathon, not a sprint.
That's for sure. Just like these clock talks.
You booked it. I'm here.
I hear you. Interesting you go to the regular doctor and you have to fill out this little survey every time you go in there. And like the third question after they've figured out if you're depressed or not is they want to know if you've fallen in the last 90 days. And that basically insults me in a way. And because I don't view myself as a 80-year-old brittle, individual at this point in time. But to your point earlier, and what I said earlier too, I mean, it is the number 4 cause of death.
Yep.
Just out of curiosity, what are the top 3?
Well, you have cardiovascular disease, you have cancer, and you have neurodegenerative diseases. Dr. Peter Attia wrote a great book called Outlive, and he writes this graph. He says, we're going to have those diseases, but the problem is they're getting younger. Let's push them further out. Be 95 and pass away in bed. Great. Okay, let's push them out. And he's huge on grip strength. Grip strength is the number 1 key for longevity. So the things we got to do to push that out. I love his ideas. Sleep, eat, exercise, and remove stress. Love it. But the 5th one we added, restore your hormones. You cannot do all those things properly unless you have the right fuel. Mm-hmm. And that's why I beat this fuel thing up, because now that I've done hundreds of thousands of encounters of this, we see that every single day, Doc, you changed my life. every single day. I thought I'd be this way forever. I thought all these things I hear. And I'm like, dang, I don't want that. I don't want it for my own side, for my own wife. I want to live today. And I think what's important is standard of care is okay for the group, but individualized care is best for the individual. I think that's what we got to focus on. You're different than me. There's some standards that are there, but you can't fit into a hole. It's a one little box. You got to look at the individual. And I think that's Optimal Bio's best thing is from our wellness program to our hormone level, we listen. I think that's our best thing to do and educate.
No, I agree, because not everybody's different, right?
Yep.
As always, 15 minutes of phenomenal information. Thank you, doctor.
You got it.